on one of our line seahorses. So the first step is to actually get the patient completely fully anesthetized. And we can do that with fish as well, like we do with mammals, and then we'll bring the animal out and then we'll start our surgery. So the goal for today is to try to debulk one of the masses that's actually grown on the animal's face. The staff noticed that there was a tumor actually growing around the eye, and so today we're going to try to go and actually remove that. So people don't realize that you can anesthetize a fish just like you can any other animal, and the way we do that is we put the anesthetic actually in the water with the animal, and as they breathe it over their gills, they start to get really sleepy and anesthetized.
Hi Zoo friends, my name is Katie Allen. I'm one of the aquarists here. I actually take care of the stingrays and the fish here at Zoo Tampa. And what we're doing today is we're working on one of our seahorses. What made us want to actually call the vet for the seahorse was it first started to get a mass on its eye, and unfortunately it just kept growing. It actually started to grow in different areas. So what we decided to do was do a couple of surgeries, and even then he's still a fighter. Here are some quick fun facts about seahorses. So the first fun fact is the males are the ones that actually carry the babies. These guys can have up to hundreds, if not more, of babies. Little tiny seahorses. They're very cute. So one of the questions that we get asked a lot here at the zoo is whether or not you can keep seahorses. Unfortunately, these guys are very difficult to keep under human care, so we really do not recommend it. You can see these awesome creatures in our manatee tunnel here at Zoo Tampa.
You can see where he used to have a tumor down here too that we removed, so he's had several procedures done. Antiseptic, just to help clear all that infection. Okay. So one thing we're going to apply to this orbit is what's called poloxamer gel. It's a thing that we've been starting to do in fish medicine. It's really challenging to adhere antibiotics and topical treatments on them, so this, because they live in aquatic environment. Now we're going to put the tiniest little suture to kind of partially close up that orbit. So this can be really challenging. They've got very delicate skin. So I'm doing a partial closure because there was evidence of an infection. I want, if there's more pus that develops, I want it to be able to drain. But at the same time, I want to encourage the skin margins to close over together and heal it nicely. So fish actually also feel pain, and what we like to do, especially for anyone under anesthesia and surgery, is to control for their pain. So I've got the tiniest little dose of anti-inflammatories here. So there's some muscle right here that I can inject this medication into. This will help with pain control. There we go. So right now our patient is recovering, so we just put him back into water that's untreated with any anesthetic.
So the little jig that we used today for the seahorse was originally 3D printed and designed by me for our x-ray cassettes, to hold x-ray cassettes. But as you guys saw, it worked really well at holding our patient still for our procedure.